Hello, NPTE Final Frontier Warriors. My name is Chase Taylor. I'm a NPTE Final Frontier team member. I would like to provide you test-taking strategies in effort to help you achieve your score and pass into NPTE. Ways to approach a question. Typically, we would read a question from the beginning to the end. But my first tip is for you to read the STEM question first. So what is the STEM? The STEM is the last sentence of the question. The physician most likely classifies this patient on the level of cognitive functioning as, so LOCF is level cognitive functioning. Okay, so that's the STEM. So now we need to ask ourselves, okay, what are the key words within the STEM question? So key words are most likely and level of cognitive functioning. Okay, so level of cognitive functioning tells you, okay, this question is a patient with a potential like TBI, right? And so we need a little bit more information. Okay, we need to figure out, okay, what are the signs and symptoms this patient is experiencing? And so by doing that, we got to revert backwards. We need to identify the main clues within the body of the question. And so the main clues in the question, when you see the words upon further examination and anything past that, that provides you okay, hint of clues to hone into. Okay, so patient seems to respond in a heightened state of activity as his behavior is more erratic and non-purposeful, incoherent, confabulations present. Also, there's verbalization that's appearing to be more inappropriate at times as well as confabulatory. All right, so we have all those pieces to put together. All right, so we need to figure out, okay, what are some of the key words? We're not interested in the skiing accident, okay, additional information, because think of, by reading additional information, that's extra time, right? So some of the key words within the body of the question: erratic, incoherent, non-purposeful, confabulation. Also, verbalizations inappropriate. So as we're thinking about, okay, patient's incoherent. If they're incoherent, that tells you, okay, the patient's confused, right? So the patient's confused. All right, we're thinking about, okay, erratic. The word erratic means the patient's agitated, correct? So when we piece in the words incoherent and erratic, the patient's confused and agitated. So that tells you, okay, this patient's at a level of 4, right? So level 4. All right, so we see, okay, patients also presenting, doing non-purposeful movements. Confabulation is also present, and verbalization is inappropriate. So that tells us, okay, it's possibly level 4. All right, so we generated an answer before reviewing the question. So that process is considered inductive reasoning. So by practicing the inductive reasoning skills, you got to be able to try to generate an answer, try to draw a conclusion based on the body of the question. So as we generated an answer, now we need to analyze each of the answer choices carefully, slowly. All right, so option 1, level 6. All right, so level 6, patient's going to be confused, appropriate, right? So again, in this case, the patient's inappropriate, confused, agitated. So level 6, it wouldn't fit the bill. So we would safely scratch level 6. Option 2, level 4, the patient's confused, agitated. All right, so you're confused, agitated. All right, we know, okay, this patient here is agitated, inappropriate. There's some incoherency, confabulation. So we know, okay, option 2 could fit the bill. So we can safely star that. Option 3, level 5, patient's confused, inappropriate. All right. So notice the difference. So inappropriate and agitated. So in level 5, the patient's non-agitated, is non-agitated. However, they're inappropriate. Uh, they're presented with some signs of confabulation and incoherency. Um, so we can safely, mark out level option 3. And so option 4, level 3, localized response. So we know, okay, um, level 3, we don't have enough information to be able to justify level 3. So we can safely scratch out option 4. What leads us to our final answer, option 2, which level 4, confused, agitated, indicating that the patient's being in a heightened state of activity in which the behavior is more erratic and non-purposeful, does not discriminate among people or objects, verbalizations, incoherent confabulations present. Level 5, the patient's confused, inappropriate. The patient will respond to simple commands consistently. Responses are non-purposeful, random, or fragmented, as well as verbalizations appearing to be inappropriate at times with confabulatory present. Level 6, confused, appropriate, indicating that the patient is demonstrating a goal-directed behavior, but relies on external input. Patients following simple commands consistently and demonstrates carryover for all functional tasks. Level 3, localized response, indicating that the patient's reacting specifically but inconsistently to stimuli, but may follow up simple commands as in closing eyes or squeezing hand in an inconsistent manner. So that's the reference I extracted the information from the O'Sullivan, page 868. All right. So as we think about our strategizing approach for the question, we need to do what? We need to read the stem first, okay? Revert backwards, identifying the main keywords within the body of the question. All right. From that, we need to generate an answer. We need to utilize that inductive reasoning skill, okay? By generating an answer before approaching the answer choices. And then once you generate an answer, once you analyze the first answer choice, ask yourself whether it's true or false. Okay, identifying, okay, if does this option match the description within the stem? All right. So carefully, slowly analyze each of the choices. Okay. After you take the test, all right, and once you receive your score, this is what your score is going to be like. You're going to have a word that says passed. All right. You got to say to yourself, you had to be confident, say, yes, I will pass the NPTE. All right. We are all here for you. All right. The team, the Final Frontier team is all here for you. All right. And if you have any further questions, please email us at enrollment@nptefinalfrontier.com for any questions. All right. And again, we want you all to remain calm and pass the NPTE. Thank you for your time.